Hello, and welcome to this presentation on working at a non-congregate shelter. This is a very fast presentation, and we hope it's helpful. Let's go. The purpose of this presentation is to provide you with a quick supplement about working in a non-congregate shelter. Non-congregate shelters are different from congregate shelters because they provide separate living spaces for our clients. They're typically established in hotels, motels, and university dormitories. When providing services to clients at hotels, the principles of Red Cross sheltering remain the same, but the services are delivered to clients differently than in congregate shelters. When you're working at the shelter, you must be proactive and engaged, making sure that our clients are receiving their needed services. We cannot assume that they are. Talk to clients and ask them about what they need. We collect client information differently when clients stay in hotels. Client registration information allows us to plan our services and better help our clients. We generally do not use the dormitory registration form that you learned about in the Shelter Fundamentals course. You may be using a smartphone, a laptop, Microsoft Excel, or a paper-based form to record and update client information. The way this is done differs depending on the capabilities and constraints of the individual disaster responses. Your supervisor will inform you how you should collect and record the needed information. The operations of non-congregate shelters vary in disasters compared to congregate shelters. They are influenced by many different factors, and you will learn how non-congregate sheltering and their services are being provided when you arrive at your disaster. If it is unclear, always ask your supervisor. There are many different approaches that are influenced by the many different factors. And how we operate at hotels varies as well. Red Cross may be present on site throughout the day or just for a few hours each day. There might be 2, 3, 4, or even more Red Cross workers who are on site for multiple shifts, or just one Red Cross worker who's on site. A supervisor may be on site at the shelter, or a supervisor may itinerate between different shelters. And the meals may be delivered to client rooms directly, or clients may be issued gift cards or debit cards to get their own food. The primary person at each shelter site has shelter management responsibilities. Each shelter site has one primary person in charge. This may be a non-congregate site manager, a site supervisor, or shelter service workers in charge. That person in charge must follow the sheltering standards, including keeping a shelter log and the referral record. They will need to submit the required client tracking and requested site data to their sheltering manager, and they will submit a daily report of issues and concerns by email or phone call to the sheltering manager or their designated lead or coordinator. Your supervisor will tell you what they want in terms of maintaining the management responsibilities, including the shelter log, submitting the information, and providing situational awareness and status reports. All workers at non-congregate sites need to interact with clients. Client-first sheltering means that we focus on the needs of individual clients and not just the facility, procedures, or supplies. Even though we may not see our clients every day or have workers at the shelter site 24/7, we must be interacting with our clients. One of the most important parts of your job is finding out how we can help our clients move forward in their recovery. Ask our clients if they need anything. Ask them if they've spoken with a caseworker or if they're hearing they're going to be able to go home soon. Take care of your clients' needs as much as you can and refer those that you can't to the appropriate person or function. If you don't know who that is, pass it to your supervisor. All clients in non-congregate shelters should be receiving individual disaster care. Disaster Health Services provides physical assessments, health education, and hands-on care as needed to clients and staff in shelters and meets with clients to ensure their health and medical needs are met. Support can include replacing medication, eyeglasses, and medical equipment. Disaster Mental Health provides basic care, support, and comfort to individuals experiencing disaster-related stress. They promote resilience and coping. DMH can check on the well-being of staff and clients. And disaster spiritual care supports clients by helping them to draw on their own spiritual resources, values, and faith amid pain and crisis. It provides compassionate and consistent services to all persons, regardless of faith tradition or no tradition at all. Types of services could include conversations to provide hope and promote resilience. IDC, or Individual Disaster Care, may visit non-congregate sites regularly or provide services virtually. If clients ask for services, collect their name and phone and pass it to your supervisor. The situations that our clients face in non-congregate shelters is different than our clients in congregate shelters. Clients are isolated from Red Cross workers and each other because they have individual living spaces. They do not have the opportunity like they would in a congregate shelter to form camaraderie with other survivors. Nor do they have regular interaction with the Red Cross staff in the dormitory, the cafeteria, the entertainment room, or the front desk of a congregate shelter. And finally, some of our clients in non-congregate shelters may in fact have less incentive to move forward towards their recovery and returning home or finding another housing situation. Red Cross workers in non-congregate shelters may be asked to do many different types of tasks. On this slide, we see a number of different types of tasks that you may be asked to do. As already mentioned, there may be significant variation of the roles and responsibilities of shelter workers, depending on the disaster type. In addition, there may be other tasks that are not listed that you may be asked to do. Always ask your supervisor what is expected during your shift. At all times, even when you're not on your shift or you're traveling to a disaster site, we must keep ourselves safe so that we protect our clients and our fellow Red Crossers. Remember, CDC, cover, distance, clean. Finally, thank you for responding to disaster. Your impact is immense, and you are serving alongside countless other Red Crossers as we fulfill our mission in non-congregate shelters. If you ever have any questions, do not hesitate to contact your supervisor, who is available to help you. Your contributions are important, and clients will remember what you do for them.